Interesting. Okay, another question. Has any information emerged showing the air quality issues in the valley have increased COVID infections or impacted outcomes?
I have not heard anything specifically. Obviously, one of the most serious effects of the virus is its impact on our respiratory systems. It tended to be, that was one of the very first identified symptoms, runny nose, cough, lower respiratory distress. So many of the patients that have died of COVID have died of respiratory failure. And so we do believe that patients with chronic obstructive pulmonary disease, COPD, patients with asthma, patients with other underlying respiratory conditions, valley fever, are they more susceptible to contracting the serious aspects of the virus? I think it makes sense given how the virus manifests itself in patients, what we've seen and the causes of death. A lot of them, as I talked about, the underlying comorbidities that we have seen in virtually every single death that we experienced in the hospital had one or more underlying comorbidities. And asthma was a big one. COPD, congestive heart failure, all of those were major contributing factors. But I've not seen any studies that have been done that have tried to directly link the quality of our air to a higher prevalence of the virus in our area.
Okay.